Well, good afternoon, everyone. Seeing as it's 3:03, we'll begin our presentation. I'm AJ Baines, President and CEO of the Amherst Chamber of Commerce, and we are absolutely delighted to partner with the Erie County Small Business Task Force for this COVID-19 contract tracing event. These have been challenging times for all of us, both professionally and personally. And as small business continues to find stable ground, it's imperative that we keep the lines of communication open with our community leaders in an effort to better understand the requirements so we do not go backwards in all of the positive strides that we have made. Today we have with us Erie County Health Commissioner Dr. Gale Burstein, who will take us through what exactly contract tracing is, why it is important, along with some additional information regarding COVID-19. After Dr. Burstein's presentation, we will open it up for a few questions. So you'll see along the bottom of your screen, there's a Q&A section. We ask that everyone use the Q&A section below for any questions that you have, not the chat box. And we also, after Dr. Burstein finishes up, also have with us Jennifer Scharf from the Coppola firm, who will provide us additional insight as to the responsibilities employers do or don't have from a human resources perspective. And again, same here. If you have any questions for Jennifer, please use the Q&A function at the bottom. Our time is limited, and while we're hopeful we will be able to get to everyone's questions, however, if we do not, please feel free to send your questions to Zoom, zoom@amherst.org, and we will follow up with you directly. Thank you again for participating in this. Dr. Burstein, thank you so much for being with us, and I'm looking forward to a great presentation.
Thank you. So good afternoon, everyone, and thanks for joining me so you'll know everything you need to know to ask about COVID-19 and contact tracing. So whoops. I don't have control of the slide. Okay, there we go. Great. So I guess the first question is, what is contact tracing? So actually, contact tracing has a couple of different components. First, we get cases of COVID-19 or any communicable disease. So we investigate the case, we find out the circumstances around the infectious disease period, and then we find out who the close contacts were to that case while they are infectious, and we notify the close contacts of their exposure. So this is actually a core public health strategy that we use to break the chain of transmission for all communicable diseases. So we do this with every single communicable disease. So let me take you step by step what we do with contact tracing for COVID-19. So first, at the Erie County Health Department, we receive all the test results for COVID-19 from Erie County residents from the New York State's electronic clinical laboratory reporting system. So that's a surveillance system. So we get that information and we give that to our contact tracers. And then what they do, first of all, is notify the people who tested positive for COVID-19 of their positive test results. And then we explain to them what that means, and then we place them in isolation for 10 days. And I'll talk about what isolation means just now. So, and then we start to conduct an investigation of the case. So we have to ask questions to determine when the onset of infection was and what the infectious period is that this person was out in the community. And then we have to try to figure out, working with that individuals and also working with businesses, who their close contacts were during their infectious period before they went into isolation to see who could have been exposed. So then we get contact information for those close contacts. We notify the close contacts that they were exposed to COVID-19, and then we place them into quarantine for 14 days, and I'll explain about that later on in this talk. And then we ensure that every single person who's placed in isolation and quarantine is able to do that. They're able to stay in a safe spot and get all their meals or their medicines or whatever they need taken care of for them, so they don't have to leave isolation or quarantine to get at anything. So what is the business's role in all this? Because you are important partners in our disease investigation and contact notification. So first of all, if a case, a COVID-19 case, is an employee at any type of business, we really need to work with that business to identify who those close contacts were in the workplace. So we're relying on the businesses to check the employee's schedule, to see where they were during the times when they were infectious before they got into isolation. Check other staff schedules to see if they could have been in the same location for more than 10 minutes that could put them at risk. And want to check the distance from the case for the other employees and other customers that come into the location, because the definition of a close contact is someone who is within 6 feet for continuously for 10 minutes or more. So we have to try to figure that out from records of businesses, records of where other staff were working, and where their locations were at the businesses, and also for their customer records if there were any customers that were in contact with the case during their infectious period while they were at work. And then we need help from the businesses to get the contact information for those close contacts, the employees or the customers, so that our contact tracers can notify those people of their exposure and put them in quarantine. And then if the businesses learn from their employees that they have tested positive for COVID-19 before the health department contacts the businesses, you can be proactive. We encourage you to be proactive, because you can report that there was a case. Are you having problems hearing me? Can everybody hear me?
It's just it's a little crackly, but I think if you sit close, we should be all right.
Okay. I will sit close. Thanks. So if you want to be proactive and notify the county that you do have a case that works in your facility, you can go to this website and fill out the form and notify us that way. So, and also besides, in addition to helping us with disease investigation, we also rely on the businesses to help us with prevention in the community. So as you know, that New York State has put out these New York Forward guidelines that is encouraging and actually mandating businesses to keep records of who was working when and what customers were coming in when, so that if there is a case, then you'll have that information available to help us with the disease investigation. And then also promoting in your workspace the physical distancing, the mask, and the PPE. And then also you really want to have strong policies to make sure that when employees are sick, they stay at home, that they don't come into work when they're sick, like probably people have done in the past, and make sure that they stay at home and they don't bring whatever illnesses is, COVID-19, or we're going to have flu soon, into the workplace to keep everybody safe. Sorry, I'm just having problems advancing. Okay, great. So what is isolation and quarantine? So what we're trying to do if somebody is diagnosed with COVID-19, we don't want them to transmit infection to anybody else in the community. So we place them in isolation. So we take them from wherever they were around other people and put them in like their own room. Hopefully they'll have access to their own bathroom. They can have meals or food brought to them, so they will have their own space and they won't come in contact to anybody else. If they, if they're in a space and they have to share a bathroom, they'll need to disinfect the bathroom after every use. If they don't have a safe space to isolate by themselves, we actually have a hotel. You can let the Erie County Health Department contact tracer know that they don't have a safe space to isolate, and we can arrange for them to have a safe stay in our hotel, and all their needs will be met. They'll have their food and they'll have medicine taken to them if they need it. And so the duration of isolation is 10 days, and that's actually the duration of infection from what we know. Quarantine is a similar concept. So we know that people who are exposed to COVID-19, they're close contacts, they could be infected and develop the infection anytime during the 14-day incubation period. So again, we want to remove them from the rest of the community and put them in quarantine so they won't expose anybody else if they do develop infection. So it's the same concept. They have to have their own space. They can't share a bathroom with anybody. If they do, they have to disinfect the bathroom after every use. They have to have food brought to them. And then in the same situation, if they don't have the same place to quarantine, they can let the contact tracers know and they will arrange for them to stay in the hotel for the duration of their 14 days of quarantine. It's 14 days for quarantine instead of 10 because we know the incubation period for COVID-19 is 14 days. We want people to be in quarantine for the duration of the 14 days. Also, we're encouraging people to get tested if they're in quarantine for COVID-19, just to get a peek to see if they are infected. Next slide, please. Don't seem to be able to advance. Could you advance for me the next slide, please? Thanks. Oh, went too far. Can you go back? Great. So the question is, well, how can an employee return back to the workplace? We use at the health department a time-based strategy. We don't need a repeat test because people can persistently test positive because the test is looking for RNA, like RNA from the COVID-19. And the RNA can hang out in a person's nose for 1 or 2 months or more sometimes. And so it doesn't mean that they're actively infected. It just means they have the RNA in their nose. So we're not looking for the RNA after we know that they've been infected. So we use a time-based strategy. So somebody who didn't have any symptoms during when they were infected, we asked them to stay in isolation for 10 days after their specimen was collected. And then for symptomatic people, we want them to stay in isolation for 10 days after the onset of their symptoms. And they have to be fever-free for the last 3 days of their isolation without using any fever medication. And their other COVID-19 symptoms, like their cough or whatever else they have to be improving. It doesn't have to be completely resolved, but it does have to be improving. Just a side note is that nursing homes, they have other additional requirements for their employees to return to work, and that is spelled out by the New York State Department of Health. So, whoops. So we can go back one, please. So, why should businesses care about contact tracing? I mean, this is something that we feel is really essential to businesses because the bottom line is businesses are open when New York is open. If New York closes down because of high numbers, then nobody can have their employees working. So you should be interested in contact tracing to help us break the chain of transmission to keep the numbers of COVID-19 down in our community. So we know that every business should be responsible to keep their customers and their employees safe and healthy. And one way to do that is, if possible, decreasing contact among your employees. So if they are able to work at home, it would be a great option for them to work at home at least, part of the work week. If it's possible, also to decrease the potential for transmission with any type of social gatherings. You will try to want to meet virtually if possible, like WebEx or Zoom. Also, you want to make sure that your employees avoid crowded places. Have some personal responsibility during their off work hours, and also you want to enforce social distancing at work. So making sure that people, if they don't have their own offices, they have cubicles or whatever they're standing at least 6 feet apart from other employees. And if you can't do that, have some type of glass barrier to protect them from any type of disease transmission. Remember, health and safety of our employees and our customers is a priority. So just want to point out that not everybody with COVID-19 has symptoms. So you cannot tell just by looking at somebody if they have COVID-19. Recently we looked at our COVID-19 case data from our contact tracing, and we found that about 2/3, recently in the past month, of all our COVID-19 cases did have symptoms at the time when they were tested. However, 1/3 did not have any symptoms. They were either pre-symptomatic when they tested positive and they developed symptoms later on, or else they never developed symptoms. So we know that people who are infected with COVID-19 may not have symptoms, and we know that those, even though they may not have symptoms, they can still transmit disease. So that's why it's important to identify everybody that is positive and put them in isolation, and identify their close contacts and put them in quarantine to remove them from the community and the workplace and break that chain of transmission. So we also, as I mentioned, we encourage all close contacts to be tested themselves, because if they test positive, then they are a case, and then we have to start the process again of disease investigation and contact notification. So we do have testing available, both diagnostic testing and antibody testing through the county. For both types of testing, you can call 716-858-2929 to schedule a test. For antibody testing, you can actually schedule that online. For antibody testing, we do take walk-ins. For the diagnostic testing, that's pretty busy, so we ask people to make an appointment. We will not take walk-ins. So this is free. There is no cost. You don't have to use your insurance. You don't need a doctor's order. You just have to make an appointment through the Erie County Health Department. And then please, if people have have an appointment scheduled already, please keep your appointment, because if somebody else would want to take your spot if you can't show up. So this is working. So our test sites are throughout Erie County. On Mondays, we have a diagnostic testing site in Williamsville. On Wednesdays, we have a diagnostic testing site in Orchard Park. And on Thursdays, we are in the city of Buffalo. For antibody testing, we are throughout the county throughout the month. So this is listed on your slides, are where we're going to be in the next week. And so you can give us a call and see where we're going to be and see if there is an antibody test near you. Also, if you want to go other places or the times or locations aren't convenient, we have actually an interactive map on our Erie County Health Department website at erie.gov/COVID test sites. So you can just click on the stars or the dots, and then a window will pop up and tell you information about the test sites, like the type of test they offer, their hours of operation, if you need a physician's order or not, and if you need to use your insurance or pay out of pocket. So pharmacies are included in this map. And then it is getting to flu season, and we don't want to have COVID-19 pandemic and a flu pandemic. I don't think we can handle two pandemics at one time. So the way to prevent a flu pandemic is to get a vaccine. Don't have a vaccine yet for COVID-19. We don't really know when that's going to be. So we know we have a good flu vaccine that is safe. And so we really hope you can encourage all your employees to get immunized against influenza. Also, because we know that influenza and COVID-19 cause similar symptoms. We don't want people to be, confused. And so the less people that have influenza and those type of symptoms, the less that will be confused with somebody potentially having COVID-19. So to find a flu vaccine clinic near you, you can use the website vaccinefinder.org, and it'll pop up where the nearest flu vaccines are available to you. We know that all the pharmacies have them. Many of the primary care providers have them. So they're in good supply right now in our community. And again, you want to encourage your employees and actually mandate, if you can, that they stay home when they're ill, and also really encourage your customers to not to come in the shop when they're ill, and just wait or call up and get an order until they feel better. So that's really important to break the chain of transmission. So I think that is all I have, and I think I can take questions right now.
Perfect. Thank
So
you very
thank you.
much, Dr. Burstein. We do have a few questions. Some I believe will be answered in the next presentation. But Dr. Burstein, do you mind just real quickly just taking us through how many people on average have been tested per week in Erie County? And what is the turnaround time that businesses could expect if they send employers to a Erie County testing facility?
Well, we know that each week there are in the county from all testing sites, not just Erie counties, but all the places in the county that offering COVID-19 testing. There's a little over 20,000 tests a week, about like anywhere between 21 to 23,000 tests a week. With Erie County, with our diagnostic testing that are offered 3 times a week, we end up doing about usually about 500 tests per week. For Erie County, our turnaround time is usually you should get results within 3 to 4 days. For the other testing sites, I know that there was a problem with short supply for testing materials, and so the testing the testing centers were having problems getting tests run. I think that the manufacturers of the testing materials have sped up production, and what I'm hearing for our contact tracers is that they're notifying people that have been infected that they were tested maybe about anywhere between 3 to 5 days before we get the test results. So that's the average turnaround time. Could be longer, could be shorter.
And we do have a question regarding the antibody testing. If someone comes back positive, what is the benefit in knowing this?
Well, you'll know that people know that they've been exposed to COVID-19 and probably infected. We don't know that much about immunity. We believe that right now that there is some type of protective immunity at least for 3 months after the infection. So we believe right now there is some protection for some duration of time. That COVID-19 hasn't been around long enough to know exactly how much protection and for how long.
One other question is, obviously you touch base on dealing with the pandemic and then also potentially a dangerous flu season. Is there a possibility of it being too early to get a flu shot, or is now a good window?
Yeah, well, the Center for Disease Control and Prevention recommends getting a flu vaccine sometime before the end of October. So, now's a good time. There is a theoretical concern, a risk that if people that may not have a robust immunity, like people that may be older, if they get the immunization too early in the season, their protection might kind of peter out before the end of the flu season, which, ends, some years not until May. However, for our seniors, there is a high dose flu vaccine that people can get to make sure that their antibody levels are even at a higher place. So, I think, anytime in October or any time that you can get a flu vaccine is a good time. But, just make sure that you get it before the end of October.
And then lastly, just to wrap up here, obviously there have been a lot of restrictions that have been put on businesses, and the state has been divided up into zones and to different regions here. I understand that you play a part in this, but ultimately the restrictions are coming out of Albany with Dr. Zucker, and the recommendations are coming from the New York State Health Commissioner. We have some businesses that unfortunately have not opened because they feel they can't meet the occupancy requirements along with the 6-foot social distancing, and others who would like to know when they can see a lift in those restrictions. So I assume you're having a daily, if not, every twice a day conversation with Dr. Zucker or somebody in his offices going forward here. Is there anything that you could share with this group in regards to the restrictions that have been put on businesses and how all of the data, as you mentioned earlier, it's very new still. We're still learning about a lot of different things here. So how we're just trying to formulate avoiding another spike or another second curve.
Right. Well, I do not have daily conversations with Dr. Zucker. And unfortunately, when we learn of a new executive order coming from the state, it's usually when you learn about it at the governor's press announcements.
Okay. All right.
So I'm not in the need to know category.
You're not in the need to know category. Okay, so, but I would just advise then for the businesses, as I've seen some of these questions fly in, these are ultimately questions in terms of the restrictions. Erie County is just carrying out the orders that are being mandated down from Albany and from the governor's office or Dr. Zucker's office.
Right. We are the local enforcement arm of those executive orders, and we do have the legal authority to enforce them. And if businesses cannot comply, we do have the authority to issue violations and potentially even close orders.
Okay, excellent. Well, thank you so much for being with us today. I'd like to turn it over now to Jennifer Scharf from the Coppola firm. Jennifer is going to take us through some of the HR responsibilities as business owners and also the do's and don'ts, because we all know this is going to hit our workplace if it hasn't already in some form or capacity. So Jennifer, thank you so much for being with us.
Hi, good afternoon. And thank you, Dr. Burstein. It's a pleasure to have the opportunity to speak with you on this panel. It's we represent a lot of small businesses, and we understand how frustrating it can be. And I think we're really lucky to be in Erie County. We're really lucky to have a health commissioner like you, Dr. Burstein, who is so communicative and willing to engage with all of us and answer these questions and give us some updates. So I thank you for that. This is tough. I go through my I hate COVID moments at least daily for so many reasons. I bet you do. So we understand, and we want to try to do what we can to help sort of demystify and give as many pointers as we possibly can. But it also puts me as a lawyer in an uncomfortable position of having to say, I don't know sometimes to the answer to a question. There's so much that we just don't know. And so that's my disclaimer here is, this is not designed for legal advice, and this guidance, it's changing all the time. When we looked at the forward.newyork.gov and the plans, the phase 2 guidance changed when it went to phase 3. There are new orders that are coming out and new guidance coming out. So we have to stay on top of it. When we look at leaves, which I'll touch on a little bit, like employees being able to take time off, there's new guidance all the time. We just had new Department of Labor guidance on the regulations that came out as of September 16th. So we have to keep keeping up on the changes to the law. So unfortunately, it's not always cut and dried, and there's not a simple legal answer to all of the questions. So I mentioned forward.ny.gov. I'm sure you all have looked at this. If you haven't, you really should. It sets forth the plans for all different industries that are open now, including those essential businesses that have been open throughout, but also all the different industries as they have been opening, and it has a safety plan that each business has to fill out and keep a copy of. And it addresses what happens if there is an exposure in the workplace. It does a lot more than that too. It gives you a lot more information and requirements, but it talks about the people, when somebody tests positive, the places, the physical space you're in, the process, and other components. So you have an employee who tests positive. What are we gonna do? So the first question to me is, has this individual been on site? If your person is teleworking and they've tested positive and they've not been on site to your physical location, it's going to be a different process. Fortunately, you're not going to have to notify your whole team because they would not have been in physical contact with coworkers. But if the person has been on site, you're going to make a plan of action. If the employee is on site when they are experiencing symptoms, you're going to obviously send that person home, suggest that they go get tested, secure the area that they've been in, and clean it. And I would recommend a really good deep industrial clean. You can hire a company to come in. Is this absolutely necessary? I don't know that it's absolutely necessary. I think that there are probably cleaning products we could employ on our own that would be good enough. But most of us aren't trained in that. There's CDC guidance, there's OSHA guidance on cleaning. You can take a look at that. The state health department has guidance. The companies that do this cleaning, though, they know what they're doing. The other benefit is it telegraphs a message to your whole team that you're taking it really seriously. It's also not that expensive. And frankly, then you don't have to worry about what am I touching and is it potentially, am I worried about what I'm handling myself? So if at all possible, Google it, call a company and have them come in and do your cleaning. And then there is some level of communication that has to go on to your other employees if the individual has been on site, tested positive, and had contact with their coworkers. One of the things I keep hearing all the time is, but it's HIPAA. And so it's not really HIPAA. HIPAA is involved, but unless you are a covered entity, you're not dealing with your employees' protected health information. What you're dealing with is private information that you need to be keeping confidential for sure. And I think that there was a question about whether somebody should be designated from HR to receive this information. And I would say yes, the New York Forward and your safety plan, you have to designate an individual to be sort of responsible for maintaining this information, just like maintaining those screening forms. So I would recommend it be someone in HR if you have that person, if you have an HR department, to help protect it and keep the information private, like we keep other HR data, like payroll data, that kind of thing, private, and social security numbers, someone who knows how to deal with private information. You do want to keep this information confidential. That said, so what do you tell your employees? You don't identify by name an individual who has tested positive, but you can identify that there was a person, and you need to identify there's a person on site who has tested positive, what day and time they were on site, and the locations they've been in. So if there's a common area, if you share an elevator or a stairwell or a lunchroom or break room or something like that where they could have been, as well as the coworkers they have come in contact with, you're going to need to let those people know that there's been a positive test. And then as Dr. Burstein mentioned, there's the reporting to the state and local Department of Health, and our local Department of Health has set up that online portal for reporting. That's a requirement in the New York Forward mandates that are out in your safety plan. So you're going to want to make sure that you report that. So some question we hear is, do other people need to then stay home, other employees? And the answer might be, yeah, maybe if there's been contact. So if you look at, and sorry, this has got a little bit small, and the title here is Interim Guidance for Public and Private Employers Returning to Work Following COVID-19 Infection or Exposure. This was issued by the New York State Department of Health on May 31st. That's the website for it. It's really long. If you just Google the title, it'll come up much easier. And it gives you the breakdown of guidance of when employees can return to work, whether if the employee himself or herself has tested positive, that person, whether or not they're symptomatic, has to at least have 10 days of isolation and after the onset of symptoms, or 10 days of isolation after the first positive test result. If somebody exhibits COVID-19 symptoms at work, they have to isolate for 10 days or until they receive a negative result. That would be a person that had the symptoms but turns out not to have COVID. If somebody has been in close proximate contact and they're symptomatic, they need to isolate, not come into work for 10 days. What is close proximate contact? That's within 6 feet of somebody who has COVID for longer than 10 minutes. If this individual is in close proximate contact and is not symptomatic, then it's 14 days of self-quarantine, but there is an exception for people who are essential and critical to the operation of the workplace. They can return if there's a documented need with human resources, coordination with the health department, and appropriate monitoring, masking, distancing, cleaning, and then quarantine when they're not at work. That seems like a lot. So I would say if you really want to make this exception, it is for somebody without whom the business really cannot run. If we can do without somebody, we might want to, right? We might want to let that person stay home and not risk exposing the whole workplace. So do employees get paid when they're off? Yeah, probably. So there are two. You probably have heard about the New York sick leave as well as the federal FFCRA or the CARES Act, the emergency paid sick leave. And there is some overlap between them. I'm we could spend an entire presentation, an entire probably half day on all of the different leaves and how they interact. But I would say that my best tip on this one is have policies and forms on these types of sick leave, and make sure the employee fills out the applications for the New York sick leave and the federal sick leave at the same time so that you're ready to go regardless of which applies. Here are some more pointers though. Use a payroll company. I understand payroll companies are expensive and there's a cost per check generally associated with using a payroll company. But in this time period of COVID-19, and with the changes to the New York law that I'm also going to touch on paid sick leave that is unrelated to COVID or not simply related to COVID that's going to take effect, having a payroll company is going to be very beneficial to you. I also mentioned you should have some written policies, but the FFCRA, the CARES Act, the time off that you give employees, there are some real good tax benefits. The federal government is trying to encourage employers to let people not work when they're sick, right? Or when they've been potentially exposed. So you may be able to avail yourself of the tax benefit. I am not an accountant, so I can't give you that advice, but what I can tell you is it has to be tracked, and a payroll company can really help with that. You, I'm sure, have all been hearing about New York paid sick leave, which New York paid sick leave starts accruing at the end of this month, and employees are eligible to use it as of January 1st. That the rate of accrual, now a lot of people are front loading time, especially for full-time employees, meaning giving all 40 hours or 56 hours, depending on how big your company is. They're giving it all in January, so you don't have to bother calculating accruals. And that works if you're kind of a traditional company with mostly full-time employees and it's easy enough to do. If you're not, if you have a more diverse workforce in terms of schedules and you're having employees accrue their time, and that may be the more common method that I'm hearing, at least anyway, using a payroll company to help you do that is a really good idea, and it is going to save you some administrative headaches. Dr. Burstein mentioned get a flu shot, and I would say encourage your employees to do the same. A lot of companies have, if you're big enough, you can call in a VNA to do like a flu clinic, a flu shot clinic for your company if you're big enough. Otherwise, if you have the flexibility to allow employees to leave a little early one day to go get a flu shot, might be a good idea. And another pointer is check your own insurance policies. And I'll talk with you a little bit about insurance that might be relevant to COVID in a few slides. So this is my reminder on paid sick leave, and it was passed in the 2021 budget bill. Covered employees are going to be entitled to start accruing leave September 30th. So this is coming really, really soon. Makes good sense to have a written policy in place before then. However, it's essential that if you're allowing employees to start accruing their time rather than front loading their time, that you are calculating it starting September 30th. Very, very important. And then employees are going to be eligible to start using that time as of January 1st, 2021. The amount of time and whether it's paid or unpaid is going to be dependent on the number of employees you have and the annual net income of your company. I think employers that have 4 or fewer employees and a net income of 1 million or less have to give 40 hours of unpaid sick leave. And employees, most people are probably going to fall within the 40 hours of paid sick leave time. But if you are a company with more than 100 employees, you're going to be talking about 56 hours of paid sick time. So another area that I keep hearing from businesses is liability. How am I going to get in trouble if there's an exposure in my workplace? Or am I going to get sued? So a couple of things. You have your employees and your coworkers. If an employee is exposed at work, an employee cannot sue their employer in New York State for a workplace injury. Instead, what we have is workers' compensation. Other states have different models. You may have heard of other lawsuits involving people who were exposed at work who have sued their employer. That's not how it works here. Here we have workers' compensation, so it'll be a workers' compensation claim. There may be a lawsuit from a customer or a visitor who was known to be exposed at your business. I'll talk a little bit about employment law claims, which would be a failure to accommodate a disability, for instance, or potentially a discrimination claim. And then, as Dr. Burstein mentioned, the Department of Health has enforcement ability here locally. And so there can be reports to the Department of Health or the Department of Labor, depending on whether the complaints relate to employees being forced to work when they don't think they're supposed to, or they don't think it's safe, versus other complaints to the health department about businesses that are not following the New York forward mandates. Those can result in fines and closures. What I hear a lot of times is, how can I not get sued? I just don't want to get sued. And I totally understand that. And the first thing I have to say is, nothing can stop you from getting sued. Somebody can sue you for no good reason at all. It doesn't mean that that lawsuit will be sustained or that the person will be able to recover or win on the lawsuit, but you can pretty much sue anyone for anything. And hopefully we don't see a lot of that, and hopefully those cases that are not valid get dismissed. But you can't really stop somebody from suing you. What you can do is try to dissuade somebody from suing you, because you're demonstrating to them how compliant you are. You're doing all of the right things. People, when they go in, they feel safe. Partly there are some visual cues you can do. You see in places with people who've put the steps on the floor so you know how to stay 6 feet away from each other. Masks are being distributed. You see all of the employees modeling good mask behavior, and they're very positive about it. So you're doing all of the things right. You're following the guidance that the state gives us, that the county gives us. And you're gonna want to do what you can to insulate yourself as best as possible by following those guidelines and insulating yourself from workers' compensation claims or lawsuits. So workers' compensation claims. I am not a workers' compensation attorney. I have friends who are, and I've talked to them, and this is sort of what I'm hearing trend-wise from them. The Workers' Compensation Board put out that employees who contract COVID-19 while they're working in an environment where exposure risks are significantly higher are going to be likely to be eligible for benefits. Workers' compensation claimants need to show that they worked in an environment where COVID-19 was prevalent, and they're going to have some sort of medical report demonstrating that they actually have COVID-19. So some of the trends are, it's difficult to pin down where somebody got COVID-19. We talked about contact tracing with Dr. Burstein, but oftentimes it's hard to figure out where the person actually got COVID, right? If you're going out to places, like you're going to the grocery store and you're going into the office, plus you're doing other things, right? You're seeing other people, you're going into other shops, you're going into restaurants, you're doing some indoor dining now. If you're doing those things, it's going to be really difficult to pinpoint where somebody got sick. If the exposure is known to have occurred in the workplace, it is probably going to be compensable under workers' compensation. But another trend that I'm hearing is there aren't really that many claims, because for the most part, there are these other leaves available to somebody who tests positive, right? They're getting their 2 weeks off for under 2 weeks paid leave, right? They're getting time that is otherwise compensated, and they're getting better, and they're coming back to work. So they don't feel the need to file a claim. And hopefully that's the case. In the more serious instances, however, it's where people have very serious injuries, where they're hospitalized, the workers' compensation claim could be more significant, and you're going to then really need to help your insurance company, your workers' comp insurance company, and the lawyer pin down whether it was a workplace exposure or not. If you believe there has been a workplace exposure, if somebody reports to you that they've got COVID and they believe they contracted it at work, you really need to be reporting it as a workers' compensation claim and working with your insurance carrier. How are we defending these claims, or how are the workers' comp attorneys defending them? Well, if you have excellent safety practices, they're compliant with the state, compliant with CDC, OSHA guidance, that's really helpful. If you have strong written policies and you're following them, that's helpful. And if you have an employee who can testify about both, an employee who can testify to comp hearing that you have these safety practices in place, you're following the state guidance, you have policies, and you follow them to a T, you're going to be in a good place to argue. So it's unlikely that this exposure happened in our workplace because we're doing the right things. Lawsuits from customers or visitors. So this is kind of a whole new world, and I guess I just don't even know the answer. There are some lawsuits I've seen and heard about, the cruise line lawsuits. It's very likely that there's going to need, like in the workers' comp context, to show that there was an exposure at the business that's being sued. What's our best defenses to these? It seems to me that the best defenses are going to be, just like we said, excellent compliance with the governmental rules, with OSHA, with CDC, with the state. Those are going to set the standard of care, the standard that companies should be doing, set the floor, the minimum steps. You want to have really well-trained employees who are careful and care about implementing them correctly. And then I would say another good tip is don't overstate in your advertising about how great your safety is at your workplace because you're doing all of these extra things. You're going to be held to that if you've been advertising. And if you really are doing those things, great. Then you might be in a good spot, but overstating or overselling yourself is going to hold you to a higher standard than maybe you have to. So I would say every good step you can take to provide safety, from distancing, from masking, from cleaning, you should be doing it, but don't necessarily oversell it in your advertisements. Employment law claims. So do we need to accommodate people? When we talk about like reasonable accommodations when someone has a disability, is COVID going to be deemed a disability? And I guess we don't know that. I would suspect yes. We have the federal leave laws that are in place. We have the state leave laws that are in place that talk about some accommodations that we can make. But one of the sort of interesting things is accommodating other folks in high risk groups. Like somebody who does not have COVID, but is in a group like a immunocompromised person, somebody who's had some sort of other illness, and somebody who, by virtue of their age, is at higher risk. Do you have to accommodate those people? Meaning give them special assistance at their job? Well, it depends. It depends on what their doctors say, as what they need and why. If it's that they need to work different hours, if you can do that, maybe it's a good idea. If it's work from home, you're going to have to assess whether that's appropriate for those people, and whether you can in fact accommodate them. If you have been having people work from home and you have someone with a doctor's note telling you that they're have a medical condition that puts them at greater risk for COVID, I think it would be sensible to look towards making those accommodations. If not, you could end up with a claim for a failure to accommodate a disability. Now, I have heard from a couple of people who are really trying to do the right thing, that they want to do it altruistically, and I get worried that there could be a claim there too. So my example is, have a company that says, oh my gosh, we have this employee who's wonderful, but she's older and we don't want to risk her. She takes the bus into work and we don't want to put her on a bus and then make her come and sit in our office. We'd rather just have her do some work from home because it puts her at risk to get on the bus and come into our office. But the employee says, oh no, I want to come in. I'm getting tired of sitting at home. I feel like I need to come in. So that makes it hard. And I think that there potentially could be a discrimination claim, an age discrimination claim, if the person is treated differently by virtue of their age, even if you're trying to do it for the right reason. So how do we win here? It seems like you can't win in this situation. Well, you have to have policies and procedures and follow them and apply them equally, regardless of who the individual is. And I don't want to say, don't be altruistic, don't try to be proactive in helping people. You should be doing that, but wait for the individual to come and make that request. Don't insert your good nature over theirs and tell somebody that they should not be coming into work if everybody else in their same job title is still coming into the office. I mentioned insurance earlier. So what type of insurance should you have? I'm sure you all have workers' compensation insurance. You're going to be working with your carrier, your TPA if you're self-insured, or your attorney if you have an exposure in the workplace. Obviously, general liability coverage, you're going to want to look at those policies to see if there's coverage if there's an exposure in the workplace. You're going to want to work with an attorney for that if you have a claim. Employment practices coverage, that would be for those discrimination or accommodation claims. You may have coverage that that would be available for those types of claims. Something else to look at is business interruption coverage. So if you had an exposure in the workplace, or more than one person had an outbreak in the workplace and you had to shut down, there's a potential that you have insurance coverage, and you should talk with your insurance agents now about the coverage you do have. There's potential you have what's known as business interruption coverage, and it may or may not apply under these circumstances. There are some insurances that exclude things like this, but other policies that might be available to you that might help in the event that your business has to be shut down for a period of time. So it would be a good time to pull your policies, to look at what you have, talk with your insurance agents, talk with your attorneys, and make sure the coverage you have is adequate, and see what coverage you have for these instances. I threw together a couple of common questions that I hear. Can I turn away customers who refuse to wear a mask? Yep, you can. Can I make my employees wear a mask? Yes, and you should be providing them to them. Can an employee refuse to come into work because he or she is afraid of getting COVID? And I would say on that one, not without more. If there is some sort of medical condition underlying it and there's a request involving the medical condition, then maybe it's a yes. But somebody simply who doesn't want to get COVID and therefore is telling you, I'm not coming into the office and not doing what all the other employees who are like me, similarly situated employees, are doing, probably can't just outright refuse to come in just because they're afraid of getting COVID. Can you force your employees to get COVID tested? You can suggest it. You can't physically force somebody to go get a COVID test. We have lots of resources here in Erie County, and I'll just put another plug for how great Erie County is. I have a friend who is in Syracuse who wanted to get a test and had to end up driving an hour away to Rome, New York, because they're in their county. They just don't have testing sites available. Dr. Burstein noted that we have several of them. Testing sites without any reason. You don't have to be symptomatic. So for instance, you could have had somebody who thinks that they were in contact with someone else who had COVID. They don't need a doctor's order. They don't need to pay. They can just go to a county site. Not every county has that availability. Can you prohibit your employees from traveling to hotspots? No, you can't actually stop them from traveling, but you can have a policy that requires them to disclose where they've traveled and then to quarantine or not come into the office for the appropriate periods after they've returned. How do I encourage my employees to stay healthy? Well, I think that the incentivizing people with the flu shot idea is a great one. Demonstrating good habits within the office, making things easily available, making sure consistent with your mandatory safety plan that you have cleaning supplies and hand sanitizer and masks available to everyone, easily accessible. Should do that. Teleworking. So we've all now experienced probably too much teleworking, but what I'm hearing from a number of people is for some businesses, and obviously it depends on the nature of the business. There are some businesses where it absolutely could not possibly work, but for others, it is working. And if it is working, maybe we expand it. I've heard some businesses talk about actually getting rid of some of their commercial real estate in an effort to have more of their employees off site and saving expenses that way. So for some people, it's working. One thing that my last point was talking about avoiding exposures, avoiding claims, and avoiding unhappy employees. One of the things that I've been hearing is a lot of parents with children who are permitted to telework are even more productive than ever because they're so grateful for the ability to be able to do their work remotely. I would just mention, if somebody is working remotely, you should make sure that you're looking at IT security, and that you have a policy about that in place, that folks are connecting securely if you have confidential information on your devices. So another question, can employees take time off if their kids are home from school, and does it need to be paid? So that's our next slide. Yes, the Emergency Family Medical Leave Act, the EFMLA, provides 10 weeks of leave for eligible employees who have to care for a son or daughter whose school or place of care is closed due to COVID precautions. What we're seeing is this does apply to hybrid days, so the days that kids are home from school, or times of the day that kids are home from school. The employees are entitled to use that leave. That said, if the employee can telework, you may not have to have them use the leave. If the employees are using the leave, there's tax benefit to it. You should be talking to your accountant, talking to a payroll company, because there may be ways to make it beneficial to you as well. A few more resources. My top piece of advice is attitude is everything, and modeling good behavior. I know we're talking here, this group is all leaders, and modeling positivity from the top down really makes a huge difference in your workforce. You know, people, wearing a mask is frustrating. Nobody likes to wear a mask. But if we talk about it as how lucky we are to be the ones to be able to protect other people rather than somebody who is in need of protection, isn't that a wonderful thing? It does go a long way to having a positive attitude in the workplace. Testing sites, Dr. Burstein already shared, but I put up the website again. How to wear a mask. So people wear their masks wrong all the time. You see that obviously, like the under the nose where they're not really covering what they need to. That's a problem. Touching the outside of one's mask, how you take it on and put it on and take it off, that affects how it impacts how effective the mask is. So the World Health Organization actually, oh, sorry, that's the wrong link that was copied there. Sorry about that. But if you Google how to wear a mask, World Health Organization, they do a cute little short video that's very helpful, and I'd highly recommend it. Same thing with how to wear gloves. People who are wearing gloves and touching everything, and then touching their cell phone and touching their face and touching their mask with the dirty gloves, are not doing themselves a whole lot of favors. So showing your employees these short little videos can be very, very helpful. So highly recommend that. And I think, just about 4 o'clock, so didn't go too far over.
Thank you so much, Jennifer.
Sure.
If you don't mind just sticking around for a couple minutes, if everybody would like to stay on, we just have a few questions, and I promise you, if you have any questions that were outstanding, please email us zoom@amherst.org. We look forward to getting those questions over to either Jennifer or to Dr. Burstein. But Jennifer, just a couple questions real quick before we go over too long here. But for confidentiality reasons, should employees tell their leader and then the leader can let HR know, or should an employee go straight to HR? What advice would you give on that?
Yeah, I would say that the mandatory safety plan has you designate somebody to be in charge of this. HR is a really good resource. If you have HR in your company, that should be the person who's the point of contact, and the HR individual should be the one coordinating communications. HR already works with the confidential and sensitive data. They know how to handle it the right way. So I would highly recommend it's one point of contact, and HR is definitely who I would start with.
And then also, what is the responsibility of the business owners in terms of if they know another employee is being tested, should they let other employees know, or should they wait till the results come back?
We were talking about that with Dr. Burstein, and she says that you don't need to let anybody know that somebody is going to be tested. And I agree that we don't really have information at that point. If you know that somebody if there's been an exposure at the workplace, you definitely want to take action then in terms of sending the individuals who have had contact home, cleaning the area, and developing a communication plan. But really, your communication comes when you get a positive test result to other employees.
Okay. And then could you clarify, someone had a question regarding if you test positive, you only have to stay out of work for 10 days, but if you were near someone and you don't have symptoms, you need to stay out for 14 days?
Yeah, so that comes from guidance from the New York State Health Department. And that's because I shouldn't speak to it. I'm not a doctor. Dr. Burstein would be better to answer it, but I believe it has to do with the length of the illness versus the length of the incubation period. And once you have the test result, right, if you have a positive test, you can calculate your 10 days from that point. But without a test result, I think that they need you to wait the 14 days. But the disclaimer there is I'm not a doctor, even though I wish I was.
Okay. And then lastly, while a business could be highly compliant in its COVID-19 protocols, obviously someone can still file a lawsuit and the business would have to then prove their compliance through the discovery process, which could be very expensive.
Well, so yes, so you can be totally compliant and still have an exposure, right? Yep. I mean, you could be totally compliant with your facility and still have somebody slip and fall and break a leg in your facility. But your level of compliance, that's going to be important. Showing it, I don't know how expensive showing your compliance is going to be because we're going to be keeping really good track of our cleaning logs. We're going to be keeping good track of what we do. The state gave us this template, and if we filled it out and we're following it and we have the right policies in place and we have somebody who can say, yes, we followed those policies every single day, I don't know that it's going to be an extraordinarily expensive discovery process.
Okay, well, thank you so much, Jennifer, and thank you to the Coppola firm for being with us today. Thank you to everyone that joined us on the call, Dr. Gale Burstein and Erie County and the Small Business Task Force. We appreciate opening up the doors here and having this conversation. If any of your questions were not answered, please feel free to email us zoom@amherst.org. And also, just so that everyone is aware, we will be posting the slides and the presentation on our website at the Amherst Chamber, amherst.org, later this week. So anyone who missed it, or if you want to go back and take a look at something for some clarification, please feel free to visit our website, amherst.org. Jennifer, Dr. Burstein, thank you so much for being with us today. I know she had to jump off, but really appreciate Erie County working with us in conjunction to get the message out there. And once again, any other questions, please feel free to reach out to us. So thank you to everyone and have a great day and stay safe, stay healthy.